Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, emerging evidence about overdose prevention centers where people go to use drugs more safely. Brandon Del Pozo is an assistant professor of medicine at the Warren Alpert Medical School at Brown. He's a lead author of a recent paper in the medical journal JAMA Network Open about what happened to crime in the areas around 2 overdose prevention centers in New York. He explains the study and its results to Dr. Josh Dartstein. Let's listen.
Dr. Brandon Del Pozo, it's great to have you on Public Health on Call. We're going to talk about your new paper, which examined whether overdose prevention sites in New York were associated with more serious crime. First, can you remind us what are overdose prevention sites in New York City?
Josh, it's great to see you again, and thanks for having me on the podcast. Overdose prevention centers are places where people can use illicit drugs, typically under supervision. If they overdose or have a negative effect, people are on hand to help them. Some might know them as safer consumption sites or safer injection sites, but in New York, they're called OPCs.
And there are not many OPCs in the United States right now. Is that true?
Well, not many that we know of. There were a few that were operating clandestinely. They've been common in Europe and Canada for some time now, but these were the first 2 government-sanctioned known overdose prevention centers in the U.S. They opened in November of 2021.
And they were controversial.
Very controversial. I mean, people were worried that they would become a magnet for crime and disorder, that they would drag down the quality of life in neighborhoods. These were 2 syringe service programs, 2 needle exchange programs that were converted to offer consumption services. But for example, as far as controversy is concerned, Philadelphia has recently just preemptively banned these types of sites. So they're very controversial.
And this study aims to get at one of those sources of controversy. Is that fair?
Yeah, that's fair to say. There's NIH-funded work forthcoming that looks at a lot of the different outcomes of these sites. There's one that's planned for Providence, Rhode Island. What we wanted to do with our interest, expertise, and the need is really look at, in the first year of operation, were there changes to crime and nuisance and disorder around the sites.
Before you tell me the results, how do you assess that question?
Right. Golden question, right? This is not a randomized trial. It's an observational study. And the way we did it was by comparing the 2 sites, which were syringe service programs to before they expanded to offer consumption. We compared those 2 sites to the 17 other syringe service programs in New York City that were brick and mortar, that were operating at least 3 days a week, and that did not, like these 2, begin offering consumption services.
So an apples to apples comparison.
Apples to apples. And just in case you wanted some peaches, we also, in a separate analysis, looked at neighborhoods with similar crime trends before the sites opened, just to give us some more robustness, as they say in these analyses.
All right. What did you find?
We found a nothing burger, which was what folks were expecting in many cases, at least I was, what some people were hoping for, to prove that when you take an existing area where people have a need, which is these neighborhoods with syringe service programs, and then you expand the offerings to include consumption, it does not put up a marquee that now draws crime and disorder and mayhem to the neighborhood. In fact, nothing additional happened. Medical calls seem to have gone down. Calls for trespass, which is what homeless folks might do if they need to consume drugs in an alleyway or a vestibule or something like that, perhaps also went down. Nothing of note really went up, but the main finding, Josh, the strongest finding, is that the police stopped enforcing drug possession in the neighborhoods of these 2 sites clearly, markedly, undeniably when they opened, which shows or suggests collaboration between police and public health to see if these sites can succeed.
So no increase in violent crime?
No. There was a slight increase in felony assaults, a decrease in misdemeanor assaults that offset it. No notable even variations otherwise in our data.
And property crime?
No significant increases in property crime.
And then you have these additional findings, such as fewer summons for drug possession. Let me ask you this question. Do you think one reason might be that in the area of an overdose prevention center, people are just carrying their drugs inside their coats and they're walking into the overdose prevention center, so it's not that easy for the police to see? Whereas in another community, they might be using on the street, and so it's pretty obvious that there's a possession happening.
Listen, that's a great point. So one of the hypotheses about safer consumption sites or overdose prevention centers is behavior that typically has to take place outside among unhoused populations, such as consumption or injection, which could result in a charge for the drugs you're seen consuming, is absorbed inside and out of view of the public. It's happening instead in the centers. That could take some more research. That could explain some of it. That's certainly a hypothesis.
So it may not be that the police have fundamentally changed their approach to seeing drugs being consumed outside. It just may be that there's less of that in neighborhoods where there are overdose prevention centers.
I understand what you're getting at, and it sounds reasonable. The New York City Police Department, rightfully so, is hesitant to go on the record about its practices. The opioid crisis is a very, very contentious topic. But folks I've spoken to will tell me, without going on the record, that the NYPD had a deliberate practice of giving the overdose prevention centers some space. More importantly, when you look at what Mayor de Blasio, but now for years, Mayor Adams has said, they support these sites. The police department answers to the mayor, and the mayor has said since day one, the new mayor, I support these sites. I want to give them a chance to succeed, and I want to expand them. So the police enforcement findings are consistent with unwavering public support for these sites by the mayor, who is the boss of the police.
So what do you think the implications of your findings are for debates and discussions about overdose prevention centers, both in New York, but also beyond?
Yeah, that's the main hope, right? That we have some effect on the debates. Well, listen, the extent to which they aggregate to a population level effect to save lives is for further research. The extent to which they save lives, there's never been a fatal overdose at a site, that's also for further research. A lot of that, there's some promising funding and research out there. We wanted to, and you need more time to figure that out. 1 year, 2 years I was talking to some researchers, like a lot of the Vancouver results in terms of health became most apparent after about 6 years, right? However, I think we can foreclose one avenue of debate, which is that there will be some marked, significant, noticeable decrease in quality of life around a syringe service program when that program starts offering overdose prevention services on site. If that is your reason for not doing this, if that's what you're raising alarm about, if that's what you're debating on the floor of a city council or a state legislature, that this is going to become a magnet for crime and disorder, our observations say no. And also our observations suggest that you can have a relationship with the police that's not overtly antagonistic and that allows the centers to operate without interference, without the collateral of more crime.
Dr. Brandon Del Pozo, thanks so much for joining me in Public Health on Call to talk about this new study.
Thanks, Josh. It was a pleasure.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.